Hi all, very good morning guys. Today we are going to have a small demo session on CCS course. Welcome to AGES Coding Health Tech. Okay, so team, coming to this CCS exam, which is Certified Coding Specialist. This exam is provided by AHIMA. Hope you guys know about AHIMA. So AHIMA is providing this CCS certification. So coming to CCS exam, this is an online based exam team, and you will be giving your exam for 400 marks. You'll be giving your exam for 400 marks. Out of 400 marks, you need to get 300 marks to clear the exam. And for this exam, you will be getting 4 hours duration. So to complete this questions for 400 marks, you'll be having 4 hours time period. And this is a computer based, online based exam only. Coming to the exam pattern. In this CCS exam, we'll be having 97 multiple choice questions team. 97 MCQs. So MCQs means there will be a small scenario or paragraph. Under that, there will be 4 options. In that 4 options, you are going to select the correct one. So in this way, you will be getting 97 multiple choice questions and 8 case scenarios. So coming to case scenarios, which is nothing but case sheet. Patient case sheet they'll be providing. So out of this 8 case sheets, 3 case sheets will be from the inpatient record, that is inpatient admission IPDRG case study, and 3 case studies will be from outpatient scenario. That is for outpatient scenario means we have to take ICD code and CPT code. Whereas in case of inpatient chart means we have to take ICD code and PCS code, ICD-10, PCS code we will be taking. And next, 2 case sheets from the emergency department. So totally, you guys will be getting 8 case studies. This is your pattern, 97 multiple choice questions and 8 case studies. Out of 8 case studies, 3 case studies is going to be from the inpatient chart, which is so we need to take ICD-10 CM, that is diagnosis code, and procedure code we will be taking from the PCS book. Whereas our 3 outpatient case studies where we'll be taking codes from the ICD-10 CM diagnosis, and procedures we will be taking CPT book, and if needed we will use appropriate modifiers. And last 2 case sheets from the emergency department. So for this exam, you guys will be using 3 books: ICD book, ICD-10 PCS book, and CPT book. These are the books which we'll use for the exam. And in the exam, they'll not be providing the book. We need to bring our own book. So we will be arranging the books for your exam. So you need to rent the books and you will be taking the books to the exam. And coming to the ID card requirements for this CCS exam. So you guys should have 2 ID cards team. Okay, so that is Aadhaar card and driving license, or passport and driving license, like that. 2 ID cards is required. Okay, so next, coming to the syllabus covered during our course. So first we'll be covering this PCS syllabus, where we will be introducing you to the PCS book, like how the PCS book will look like, how to use the book, what are the character values, and how many chapters are present in the PCS book, and how to use that PCS book first. In this way, we will be covering this PCS topics first, and in detail we will discuss each and every chapter. Say for example, digestive system procedures, cardiovascular system procedures, like that. So after completing PCS, then we will be discussing this UHDDS guidelines, how to take the principal diagnosis and how to code the principal procedure, like that. So the principal diagnosis code is nothing but the very first diagnosis which you are writing for the patient, which is nothing but the condition which is chiefly responsible for the patient's hospital admission. Say for example, I'm going to the hospital with severe fever, means that fever is the diagnosis here. So in this way, like if I'm having multiple conditions, I'm having fever, along with that I'm having hypertension, diabetes, like that, means in that which one we need to code first, that is the principal diagnosis, and other conditions will be coded as secondary diagnosis. So those things we will explain, how to pick the principal diagnosis, how to pick the secondary diagnosis code, and if any procedure is performed on a patient, so which procedure we need to code first, which we need to code after that, those things will be discussed. Next, coming to the concept of DRG. So this inpatient payment will be based on the DRG team. So DRG is a 3-digit number. For each inpatient admission, patient will get one DRG. Based on the DRG will be, payment will be provided. So this we will explain, like what are the types of DRG and how the DRG will affect the payment, because each DRG will have a separate amount. So how this DRG is affecting the payment, one will fetch you higher payment, one will fetch you very low payment, like that. And after that, we'll be covering this parts of IP records. Like if you are given with a IP case sheet, means like what are the contents it will contain, starting from the discharge summary. So first discharge summary will be displayed. Then the other conditions like phase sheet, that is admission form, a physical examination, history and progress notes, physician orders, and if there is any other reports, radiology report, pathology report, consultation report, and if they have performed any surgery, means that operative report, everything will be present. So those we will discuss. What are the things present in a IP record, and what are the types of IP facilities, because we are having acute care hospital, long-term care hospital, like that. So those things will be discussed. Next, coming to pharmacology. So pharmacology means frequently used drugs we will discuss. Then after that, we will be teaching the physician queries. So let me explain the query in the upcoming slide. Then we will discuss the ICD. That is how we will be picking the diagnosis code and what are the chapters present in the ICD-10 CM book. So those things will be discussed, and chapter specific coding guidelines, because each chapter is having its own guidelines. So those chapter specific coding guidelines we will discuss, and then we will discuss the CPT book, that is CPT coding guidelines, and all the chapter specific guidelines we will discuss. Okay, so let us come back to your CCS exam. As I have said, you will be taking the exam for 400 marks. So they have divided this exam into 5 domains. So from these domains only you will be getting questions. So out of 100 percentage, 39 to 41 percentage questions will be from coding knowledge and skills. So coming to this coding knowledge and skills, which is nothing but, so how you are abstracting information from a patient's record. So you are going to have a patient's record. So they will frame a scenario, or a single paragraph they'll give. So they'll frame a scenario, patient is admitted for this and he got this treatment, like that. From this, how you are picking the principal diagnosis and what code we need to report as secondary diagnosis, and which code should be reported as a principal procedure. So these things and all will be covered under domain 1. So they'll be giving a scenario. You have to make use of the ICD book to take the correct ICD code. And you need to use the PCS book to take the correct procedure code. Whereas if it is a outpatient case study means you will be using CPT book to take the procedure code. Then if needed, we need to use some appropriate modifiers. If needed, with CPT code, we will be using appropriate modifiers. So this is how questions will be framed. Nearly 39 of the questions. And next is applying present on admission guidelines. So this present on admission is nothing but team, if that condition is present during hospital admission or not, because some conditions patient will develop even before hospital admission, but some conditions will develop after the hospital admission only. So if a patient is admitted for one condition and after he is getting admitted to the hospital, if he develops a lot of problems, then the meaning is the quality of care provided by that hospital is very poor. So for identifying the quality of care provided to the patients, we will be using POA indicators. That is, if a problem is present on admission or not. So those things and all, we should abstract from the document. Next is MCC and CC conditions. That is major comorbidity conditions and comorbidity conditions, which is nothing but which will use the resource. More hospital resource will be used if a patient is having a major complication or comorbidity. Say for example, I'm the patient and I'm getting admitted to the hospital. So say for example, for fever, I'm getting admitted to the hospital. So if the only problem is fever and apart from that, I'm not having any other health issues means then they can treat me easily. But assume that I'm having hypertension and I'm having some cardiac problem and I'm diabetic, obesity. So if those conditions are present, then physician need to keep those things in mind and based on that only they need to frame the treatment plan. So this will be more resource intensive to the hospital, right? So if a patient is having a major complication or comorbidity then the resource used by that patient, that is both the material resource as well as the human resource the hospital is providing, is much more than a normal patient. So this will also affect the DRG. This will also affect the payment because this is not same, right? So a doctor is treating a patient. So both are having the same diagnosis. But one patient is very healthy, but another patient is having other chronic illness also means then the patient who is having some other chronic illness, extra care should be taken by the physician and they need to plan accordingly. So the physician needs increased payment compared to a normal patient, right? So those things and all we should know. We should know for coding this MCC and CC. This MCC and CC, we need to fetch from the patient's medical record. Next, coming to domain 2, which is coding documentation. So from coding documentation, there will be 18 to 22% of the questions will be from coding documentation. So here how you guys will be getting questions is same scenario based questions only team. Small scenarios they'll provide. But the question and the answers will be conflicting. See, question laterality they'll be giving right side. Okay, so in the question, So in the first statement, they'll be giving it as laterality right side. And in the last statement, they will be giving it as left side. So we need to identify where the problem is. So in this way, there will be some problems with the laterality, right side, left side, and the diagnosis, selecting the principal diagnosis. So those things. So we need to verify the question. So this will be scenario based only. You will not be getting the entire case sheet. Small scenario based only. So you need to read this scenario multiple times to select the right answer. Okay, so laterality is right or left. That we should be aware. So from these things, you will be getting 18 to 22% of your question. And selecting the appropriate code also. Like if there is a problem with the code, whether the diagnosis is not clear, like that and all. Next, coming to domain 3, which is provider queries. From this, you will be getting 9 to 11% of your questions. So let me explain this query. Query means nothing but questioning. So when we will question someone, if something is not clear, we will ask them again, like what is this? Like that we will ask them again, right? So that is what querying is. So we coders will query the physicians. So if the documentation is not clear means, then we can query so that we can take the appropriate code. So if the documentation is not clear, if it is incomplete or if it is not clear, like that means, or if there is a problem with the staging or laterality, like that means, then you can query the provider. That is like whether patient is having this problem during admission or not, and what stage the patient is having, like that. So this is what querying is. If something is unclear, you are going to query the physician. Because if it is not clear means we will not code on our assumption. Say for example, some signs and symptoms they have provided, some clinical indicators and signs and symptoms related to a specific disease they have provided. But that disease name is nowhere mentioned in the document. Then in that case, we should not assume ourselves, okay, so these conditions are given means definitely this will be a this particular disease only. Instead, you need to query the physician. As you have documented all these signs and symptoms and clinical indicators, whether patient is having this disease or not, like that, we will be querying the physician. So can you please specify, like that? So this is what querying is. So from querying, there will be 9 to 11% of question. So in querying, how you will be getting question is, which one is a compliant query? So compliant means which one is a proper query? Which one is not a proper query? So it is not proper means why it is not proper. Whereas if it is a correct or proper query means then why it is correct, why you are saying it is correct, why you are saying it is not a proper query, like that you will be getting questions. Okay, so next coming to domain 4, from this you will be getting 18 to 22% of the questions. That is from regulatory compliance. So regulatory compliance means nothing but some rules and regulations which we need to follow. This is what compliance is. Some rules which we need to follow, which is nothing but as we coders are dealing with patients' protected health information. So we are dealing with the patient's sensitive information, patient name, his details, his personal details, then his disease condition. So his personal details and all, we are dealing with the patient's personal details. So how we should handle this information. That is, we should not disclose this information to others. We should not use it for our personal use. These things and all there, right? So that comes under regulatory and compliance. As a coder, what are all the ethics we should follow? Okay, so how a professional coder should behave. So these things and all will be covered under regulatory and compliance, and some payer guidelines also. Each payer will be having some guidelines. The government payers and all, they'll be having their own guidelines. So those guidelines, and for how many years we need to maintain a record, and how it should be destroyed, like that. Next, coming to domain 5, which deals with information technology. So you'll be getting 9 to 11% of the questions from this information technology. Team, this is a newly added domain. Only from April 2024, they have added this domain. Previously, we are not having this domain. Only from April 2024, they have added this domain. So here we will be having questions based on the electronic health record and computer assisted coding, which is nothing but AI. Nowadays we are dealing with this artificial intelligence, right? Like how we are using this computer assisted coding, and so how we should fetch the codes captured by this computer assisted coding, because it will capture the codes. So the thing is, we need to take the appropriate codes. It will capture all the possible codes. From that, we need to check whether it is correct or not. So those things and all will be discussed in the domain 5. So this is all about your CCS exam pattern and syllabus. Next, coming to our CCS exam course. So we are running 2 courses. One is slow track, another one is fast track batch. So coming to slow track batch is preferred for fresher candidates. So fresher means who are not aware of medical coding. So we are just new to this medical coding field. Like for those people, we will be preferring slow track batch. Because in slow track batch, we can able to cover from scratch, like what is medical coding, what we are going to do here, what is revenue cycle management, like that. And team, we are providing both online as well as offline batches. So whichever is convenient, you can make use of that. If you are comfortable with online, you can go with online, or if you are comfortable with offline, you can come offline. Next, coming to the batches, we are having both weekdays and weekend batches. So in case of weekdays means your classes will be from Monday to Friday. Weekdays batch classes will be from Monday to Friday, 8:30 p.m. to 10 p.m., 1.5 hours. Because mostly we'll be getting some working candidates, right? So for your convenience only, we have scheduled timings like this, 8:30 p.m. to 10, Monday to Friday. Or if you are not comfortable with weekdays means, then you can opt for weekend batch also, Saturdays and Sundays, 6 p.m. to 9 p.m. So first I'm talking about online mode. So online classes, weekdays batch sessions will be from 8:30 p.m. to 10 p.m. Monday to Friday. Or if you want to take weekend online means, classes will be only on Saturdays and Sundays from 6 p.m. to 9 p.m. Or else, if you want to take offline mode, offline classes means, so offline weekdays batch, or that is weekdays timings will be 10 a.m. to 1 p.m. Monday to Friday, from morning 10 a.m. to 1 p.m. Or if you want to opt for offline weekend means, classes will be on Saturdays and Sundays from 10 a.m. morning 10 a.m. to 3 p.m. So for both, you will need 45 days to complete your course. Whereas Some people will say, ma'am, I'm already having experience in coding. I have worked in HCZ coding, or I have worked as a IPDRG coder, or I have worked as a ENM coder, ED coder, surgery coder. So like that, some people will be from coding background. Already they may have worked for 6 months, 1 year, 2 years, 3 years like that. For those people, we will be preferring fast track batch, because you guys are already into medical coding and you guys know how to use the ICD book, CPT book, and PCS book and all. So if you are an ENM or ED coder or a surgery coder means, then definitely you will be aware of ICD book and CPT book. Whereas if you are a IPDRG coder means, then definitely you are aware of ICD and the PCS book. So we will prefer for fast track batch if you are a experienced coder. So for fast track batch, you need to spend 25 days. Course duration is 25 days. And session timings will be same, like Monday to Friday, 8:30 p.m. to 10 online, or weekend batch means Saturdays and Sundays, 6 p.m. to 9 p.m. So in fast track batch, we will be discussing the mock papers. Whereas in case of your uh, this slow track, we need to cover the ICD guidelines, CPT and PCS guidelines, everything. Whereas in case of fast track batch, we will be covering, so we'll be giving a brief outline of these things, and in detail, we'll be discussing the mock papers. Because the ultimate purpose of joining a fast track course is to clear your CCS exam as much as quickly as possible. And for the same fast track batch, we are having offline batches also. And for offline, also, you need to spend 25 days. Weekdays batch, Monday to Friday, 10 a.m. to 1 p.m. Whereas weekend offline means Saturdays and Sundays, 10 a.m. to 3 p.m. Okay. So far, I'm discussing about the CCS exam, right? Now I'm coming to the fee details for the CCS exam. So coming to the CCS exam, exam fees without membership, that is without AHIMA membership. For one attempt, it is 40,500. For two attempts, it is 49,500. Whereas exam fee details along with AHIMA membership, that is, you will be getting the one attempt as well as AHIMA membership for 42,000. So just 1,500 extra. That's all. Whereas in case of two attempts, that is exam fee with membership for two attempts, it will be 54,000 rupees. So the charges which I'm displaying here includes all the rental charges for the books and the forex charges also. So forex charges means for converting, because it will be provided in dollar value, right? For that conversion, we need to spend this forex charges and all. So the fee which I'm displaying here includes all this. It is inclusive of all that is for the book rent also. As I have said, in case of CCS exam, we need to bring our book. They will not provide the book in the exam hall. Now let me explain the advantages of CCS over CPZ and CIC. So as I said, the CCS exam is offered by AHIMA, whereas your CPC and CIC exam is offered by AAPC. So this is the difference. Next difference is, in case of CCS exam, as I have shown the exam pattern, everything, with that you can able to know the CCS exam test your knowledge in both outpatient coding as well as inpatient coding. So it tests your knowledge in outpatient as well as inpatient coding. So as a fresher, if you want to take an exam means, I'll prefer CCS over CPC and CIC. Because, so if you're taking, assume that you are taking CPC exam. The CPC exam will test your knowledge only in the outpatient coding. Whereas if you want to take CIC exam, it will test your knowledge only in the inpatient coding. So if you have completed CPC exam, you can work only in the outpatient coding. That is ED, ENM, surgery, radiology, pathology. This alone you can work. You can't work as a IPDRG coder. Whereas if you are completing CIC exam, you can work only as a IPDRG coder. You can't enter into the surgery coding, EDM and all. Whereas if you have completed the CCS exam means, so you are having the dual advantage. So you can enter as an outpatient as well as inpatient coder. So in future, if you want to shift your facility from outpatient to inpatient, from inpatient to outpatient, you can easily do this with the help of CCS. And comparing the fee structure also, in case of this CCS exam, so maximum you are going to spend 54,000 for 2 attempts with membership. And 1 attempt without membership means you are just going to spend 40,500 alone. Whereas in case of the CPC exam, it will cost you around nearly 60,000. And as I have said, like you have completed CPC, and if you want to take further, if you want to take CIC, again you need to spend 60,000 and you need to take the next exam. Okay, so then only like you can work as a both outpatient and inpatient coder, because CPC will test your knowledge only in outpatient and CIC will test your knowledge only in the inpatient charts. Whereas in, as I have said, CCS tests your knowledge in both outpatient and inpatient. So it is having a dual advantage. With a single payment, you are getting the knowledge of both outpatient and inpatient coder. And here you will be having a doubt. Ma'am, you have provided 2 fees here. One is with membership, another one is without membership. Then what is the advantage of getting this membership? So the advantage of getting membership is that you can get some free CEUs. Because, so after you are getting credentialated from Mahima, then you to maintain this credential, which is nothing but like you are clearing your CCS exam, okay? So after clearing your CCS exam, you need to maintain this certificate, right? So for that, you need to take CEUs. So if with the membership means you can able to get some free CEUs and all, free lectures and all you can able to attend to grab the CEUs. Whereas without membership means you need to pay for the CEUs. And the next advantage of this getting membership is like if you are having membership means if you're not able to clear your exam in first attempt and if you want to go for second attempt means you can take your exam in a much lower fees. Whereas without membership means you have to pay high. So this is the next problem. So it is advisable to go with membership. Okay. So next coming to our courses. So we are having 2 plans team. One is basic plan, another one is premium plan. So basic plan, the cost is 15,000 rupees. And after discount, now we are charging only 12,000 rupees. And in case of premium plan, it is 20,000. After discount, it is 16,000 only. And we are offering this installment options also. Like you can pay in 2 installment. So basic plan 12,000 means first installment you can pay 6,000 and after that you can pay the next 6,000 like that. But if you are ready to pay in a single installment, so if you are paying in a single installment, instead of taking this 2 installment, if you are paying as a single attempt, then from the discounted fee also, again, we are discounting 20%. So from 12,000, again, there will be 20% discount if you are, if you can able to pay in a single installment. And similarly, from this premium plan, that is, which is 16,000, if you are ready to pay in a single installment, so here also you will be getting 20% discount from this 16,000 rupees. Now you'll be having a doubt. Then what is the difference between this basic plan and premium plan? Na? Let me explain this benefits of basic plan and premium plan. So coming to the basic plan, in basic plan, you will be getting the soft copies of the ICD-10 CM, PCS, and CPT book, soft copy, and anatomy, physiology, and medical terminology, soft copy, and CCS study guide and question bank, soft copy. All this you will be getting soft copies only. So the 3 coding books and anatomy, physiology, and medical terminology book, as well as the CCS study guide. So these 5 materials you will be getting soft copy in case of basic plan. Whereas if you are opting for premium plan, we are providing soft copy as well as the hard copy. So physical copy also. So hard copy also we are providing. So all this you are getting physical copy. That is ICD 10 CM book, PCS book, CPT book, anatomy, physiology, and medical terminology book, as well as the CCS study guide. All the 5 materials which I have discussed in the basic plan, you are going to get physical copy as well. Along with soft copy, you are going to get the physical copy as well in the premium plan. So this is the major advantage between the basic and premium plan. And coming to the next advantage, so you will be having access to our app materials for 6 months in case of basic plan, or for 1 year in case of premium plan. So let me explain about this mobile app and desktop site. All the study materials we will be uploading in that app. We have already uploaded all the mock papers and practice question papers, practice case studies. So everything we have uploaded in the app. And coming to the session, like you are attending the, like assume that you're not able to attend a session. You have missed a session. Okay. So class recordings also we are providing. So the live class recording, we will upload in the app. So today I'm taking, so 8th of January, if I'm taking a class and if you're not able to attend that class means, so the class recording we are uploading in that app. So on a later date also, you can go through that. So we are providing class recordings also. So this class recordings will be available for 6 months in case of basic plan, whereas in case of premium plan, it is for 1 year. You can make use of this recorded sessions. And next thing is, like, if you're opting for a offline, but you're not able to continue in offline means, you can come online. Or if you have enrolled for online, but if you want to come offline means, then you can switch between online and offline, weekdays and weekend. Like that, you can swap the options also. Like if you are not comfortable with weekends means, then you can go with weekdays. If you're not comfortable with weekdays, you can come with weekend. Like that, you can change. So, but this will be for 6 months in case of basic plan, whereas in case of premium plan, it will be 1 year. So in case of this premium plan, you are getting 1 year recordings, that is 1 year study materials is available. Everything is for 1 year, but in case of basic plan, it is only for 6 months. And in case of premium plan, you are getting soft copy as well as physical copy also. So this is the difference between premium plan and basic plan. Okay. So coming to our training benefits compared to other training institutes. Team, the materials which we are providing here. So the mock papers you are taking, right? So it is designed by our CCS tutors, and we are having the CCS exam study guide. So you will be getting, in case of CCS exam, you will be getting many frequently asked, that is repeated questions you will get in CCS exam. So those frequently asked questions, repeated questions and all, you'll get practice here itself. So we'll be giving a lot of practice for this frequently asked questions. So you'll be very well versed in these repeated topics, repeated questions and all. And the next thing is trainers will be available in Tamil, English, Hindi, as well as Telugu. And this mobile application and laptop material you are using, right? So here you are getting a recorded session also. So if you if you take other institutes, means you will not be able to get recorded session. So like if you have missed a session, means again you need to wait to attend. You can attend in the next batch, like that they'll say. But here you are having that recorded session. So due to some unavoidable circumstances, if you're not able to attend, or if your network is not stable, like if you're attending online batches and if your network is not stable, means then the recorded session is going to be available. So in a later date, you can view it. And the next thing is, like those who are attending this demo session, so we are giving free access for 3 days team. So 3 days app access we are providing to you. Okay, so in that you can attend the sessions, live sessions, you can attend recorded sessions, you can able to view, and assessments we have uploaded. So many practice assessments we have uploaded. So those assessments you can take and you can test your knowledge. So this will be available for 3 days. It will be free. And after that, if you have paid the amount, means then it will be available for like basic plan you are selecting, means for 6 months, or premium plan means for 1 year. But if you're not paying any fee, means then automatically after 3 days, the app access will get expired. So you can able to know about the material which we are providing. So you can go through all the materials in this 3 days. 3 days free access is there, right? So in that you can go through the materials, like what are all the materials we are providing to you now. And that's all from my end, team. Thank you. Thank you, team. For any queries, you can contact us. We are ready to answer you, team. Thank you.